Hello, guys. How are you doing? Welcome to the YouTube channel Health Q, the place where our mission is to motivate you to look at the brighter side of the health. So, I'm logging in on YouTube as well as Instagram. So, hello, Instagrammers. How are you doing? So, this is the live video session which I'm doing especially for people who are experiencing or is suffering from Bell's palsy problem. I know since lockdown is going on, many of you are not able to go for your regular physiotherapy sessions, and that's why I thought let me do this live video session so that I can help you out in my side to do in the initial days or as first 30 days of Bell's palsy. These are the important days. The exercise intensity also should be something that needs to be very gradually started. You should not do too much of exercise, nor you should just stay without doing exercise. So I would be very precisely talking about the initial days of Bell's palsy. And at the same time, I will be demonstrating you the exercises, what all exercises you should do for Bell's palsy management in the initial days. And after that, I will be sharing some of the do's and don'ts, the things that you should do, things that you should avoid during this time. And at the end, I'll take some of the questions that you have got. So we have already got some people online on Instagram as well as YouTube. So on YouTube, there is Lota. Hi, Lota. Um, Maimu is there. Hi, Maimu. Harry is there. Hi, Harry. Madhusudan is there. Hello, Madhusudan. Hello, Sugnesh. Thank you for joining in. So I think it's good to start off with. Okay, so let's start with Bell's palsy. Bell's palsy is a condition which is a neurological disorder in which there is an inflammatory response or as infection or inflammation that happens to your facial. Okay, so I think I have crossed. Okay, facial now. So hi Prachi, thank you for joining in. So nerve or else facial muscles is something that gets impacted due to Bell's palsy. So, whenever the Bell's palsy happens, this is usually a condition which isn't mostly, like in 80% of cases, recovers completely. 80% of people will be completely normal by end of 3 months. They will not be having any kind of residual symptoms or anything. But yes, there are also remaining 20% of people who will always have some sort of impairment that they have to carry for a long period of time. Now, these group of people are usually someone who will find it difficult to solve their problem. It's very difficult for them to work on that residual impact, and there's not much help available for them. But it's hence very important that if in the initial days of Bell's palsy, if we are able to correct it, control it, and if we are able to manage it in the best possible way, you will be having minimal impact in later stages. Hence, it's very important that if you are having Bell's palsy or else facial paralysis, you should seek medical help as soon as possible. So there are a few more people who have joined in. Hi, Sanket. Hi, Romisa. Hello, I'm fine. Thank you so much for joining in. Yeah, so we are today talking about the management in the initial days of Bell's palsy. So I spoke about Bell's palsy. Now, facial paralysis can be due to some other reasons as well, like stroke, paralysis, brain hemorrhage. These paralysis, brain hemorrhage. These situation can also lead to facial paralysis. Even if you have got some traumatic to facial paralysis, even if you have got some traumatic brain injury, at that time also you might experience facial paralysis. Hello, Sanket. Um, Anam is there. Hi, Anam. Yeah. So that is one thing. So I would be taking the questions by at the end of the session. So please keep on posting your questions. First, I'll yeah. So that is one thing. So I would be taking the questions by at the end of the session. So please keep on posting your questions. First, I'll talk about all the things talk about all the things, important stuff that I have to talk in today's video, and then we will come to your questions. Definitely, I've kept almost 20 minutes of time of this session to answer your queries. So please stay tuned with me on this live video session till the end. Okay, session till the end. Okay, so let's continue with Bell's palsy. So yes, as I mentioned, apart from Bell's palsy, there could be some other conditions as well, which will have facial paralytic symptoms. But Bell's palsy and facial paralysis are different. Hence, the course of treatment sometimes varies, and at the same time, also the duration for which the recovery happens, or else what extent the recovery happens, also depends on what kind of injury or else what is the pathology behind the facial paralysis. Now, depending on the level of nerve damage that has happened, the severity of the symptoms would be there. Hence, if you who are someone who has experienced Bell's palsy and is left with complete paralysis of your face, which means your face of one side is absolutely paralyzed, there's no movement that you can feel, your face is totally drooped, then this is something where the inflammation could be much higher. In few people, there is mild attack of Bell's palsy. In those people, the weakness will be there. There would be some asymmetry, but there wouldn't be a complete paralysis of the face. Hence, it's very important to get the diagnosis done as to what extent the facial paralysis or else Bell's palsy damage has happened. So, now since lockdown is going on, if you have experienced some sort of the symptoms like first drooping of the face, inability of moving, first drooping of the face, inability of moving the face in a proper way, inability to do the facial expressions effectively, inability or else difficulty in your speaking, difficulty in chewing your food. If this kind of things are happening, then it is possible that you are having facial paralysis. Okay, now okay, now facial paralysis needs to be diagnosed, whether it is, and I'll just first finish my talk, and then at the end of this video I will answer all the questions that you have you have questioned in the comment section below. So please be patient. Okay, so now in this Bell's palsy situation, what should be done? First thing I would recommend, if you have ever experienced this kind of paralytic symptoms on your face, first and foremost, either go to an emergency ward and see a physician, and if that is not possible to you for you, at least give a call to your physician and tell about your symptoms. What doctor will give? Doctor basically will ask for your history based on, and the most important ones are the eye drops. Since when you have Bell's palsy, it is not possible for you to close your eyes completely. When you are not able to close your eyes completely, what will happen is there would be more irritation that will happen in your eyes. This irritation will lead to secondary infection of the eye and will damage your eye. Hence, regularly application or putting of eye drops is very important. So this is the first step that you are going to do if you are experiencing any sort of facial weakness. Talk to your physician immediately. Get your diagnosis done. Now, your diagnosis is done, and now it's the time for treatment. Now, Bell's palsy or else facial paralysis treatment usually comprises of medications, and second is the exercises, or else you can say physiotherapy treatment. Physiotherapy treatment usually comprises of three things. One is the electrical modality. In Bell's palsy situation, it is called as electrical muscle stimulation. Second is facial muscle exercises, or as you can say, facial rehabilitation. And third is facial muscles that will happen by the pull of gravity. Okay, so this is what you are supposed to do. Now you must be thinking, since lockdown is going on, I cannot go out. How I will take electrical muscle? Very good question. And the answer to that question is it's not necessary that you need to take electrical muscle stimulation. You are having a complete paralysis of your facial muscles, which means your facial muscles, any of the facial muscles, is showing zero movement at all. There is no contraction like this facial expression, closing your eyes, smiling. All these expressions, when they have gone away, the movement starts becoming normal, or else even there is a slightest of contraction that's present on your face, then you do not need electrical muscle stimulation. And mostly 80% plus cases, you will see some recovery happening to be there immediately after your Bell's palsy attack. Only 1% of people will be there who will have zero recovery after Bell's palsy. It doesn't happen at all. So don't worry if you do not have electrical muscle stimulation, still you can recover very well. So now, what you are supposed to do if you are in lockdown and you want to take physiotherapy for your facial muscles which have got paralyzed. Most importantly, as I said, is the